There is, of course, a lot of hope. So, and the hope comes from, at least the way I see it in the digital world, is that there is access to smartphones at a cost that is a fraction of what it used to be, access to data packages. It's huge because from a health perspective, it empowers citizens, right? Like typically health is driven by the healthcare sectors, but access to phones where citizens are accessing healthcare on their phones empowers citizens. It changes the power dynamics. And so there is lots of applications of AI and climate on just this. Of course, it doesn't reach everybody. So those are the problems, right? There is also a huge movement in many countries towards collection of community level data and digitization of health service data. These are huge because, and they're built on, to our earlier conversation about digital public infrastructure, they are built on the concept of digital identity. Because in many countries, we didn't have a digital identity, right? Like we didn't have an identity at all, let alone a digital identity. So that's the equivalent of a social security number, right? And so countries are just beginning to introduce over the last decade these digital identities. And what that allows in the healthcare sector is to have longitudinal records and then also to link multiple sources of data. And so that's hugely, tremendously powerful. And so you'll see that some of the innovations that are hopefully helping health outcomes are actually not coming from the healthcare sector. They're coming from other sectors, right? Like these are other sectors. And so this collection of community data and digitization of health service data offers huge opportunities because what it allows us to do is connect multiple data sources. So when a community healthcare worker goes out into the community, she can enter GIS location, right? She can enter access to where is the well, where is the household. She can link the household to that specific location. So now we have a household with a digital identity linked to a well and to their GIS location. We can have satellite imagery that can look at that sort of geography. So if you're thinking about terrain or, sort of a drought-prone area, we can sort of cross-map some of that data. And this is, I think, to some extent theoretical. It's not a scaled solution yet, right? But we see a lot of like great hope. Actually, in the state of Rajasthan, I think, so the population's roughly 80 million. And about half the population has been digitized on a singular platform. It's called Kushi Baby. And so they've done a lot of this work where they've got all of this health data and they've sort of cross-mapped it, right, with multiple sort of data sources. And that's when we can start to really look at the interlinkages between the social determinants, environmental determinants, agricultural determinants, and health outcomes.